Hi there, it's Beth Innis, and I am coming to you doing this Facebook Live. Today, I am going to talk about hospice care for pets. So, first, in case you don't know me, let me introduce myself. I am, oops, now I'm having some technical difficulties. Sorry about that. I am a small animal veterinarian, and I became a veterinarian in 2003 with, gosh, sorry, my little thing is not working right. Just bear with me here. Um, anyway, sorry about that. Technical difficulties. So I graduated from Tufts Veterinary School in 2003. Tufts Vet is a school that can train you in both small animal and large animal medicine. I chose small animal medicine. And after I finished vet school, I went into general practice and emergency care. And I did that for a couple years while studying to become certified in veterinary acupuncture. After that, I became certified in veterinary rehabilitation medicine or therapy. And after that, I was led into Chinese herbal medicine and became certified in that. During that time, I did mostly general practice and acupuncture and herbal medicine. I also did some ER medicine. I did a lot of house calls by the end of that time until I finally opened my clinic as it stands now, Sleepy Dog Veterinary, in 2016. After I opened that, I became certified in veterinary spinal manipulation therapy, also in Massachusetts known as animal chiropractics. And over the years, I've also done training in Chinese veterinary food therapy. I became certified in pet loss and bereavement, and I've done a lot of training in veterinary hospice care. So that is the topic of today's talk. And so the first question I kind of set out to remind myself of in terms of what is the definition of hospice when it comes to human medicine. So hospice is defined as the type of healthcare that focuses on the palliation of a terminally ill patient, focusing on their pain and symptoms and attending to their emotional and spiritual needs at the end of their life. The priorities are comfort and quality of life by reducing pain and suffering. And I think that if we substitute all the things for animals, I think that we can gain the same thing and the same understanding of what is animal hospice care. Animal hospice care can be a little bit confusing because some people term it animal hospice, some people term it palliative care, some people say end of life care, and a lot of times it is actually mistaken for humane euthanasia, but really it's a whole medicine that applies to the end of an animal's life and how we manage that. When it comes to the philosophy of hospice, the philosophy in human hospice is that you are assisting an individual near the ending of life. And so the goal is to improve the quality of life that remains for that person by providing care of the patient and their family rather than attempting to cure the disease. So at this point in human medicine, we have decided that the patient is unable to be cured and the challenge is unable to be resolved. And so we are going to improve the quality of life and focus on that for both the patient and the family. To me, this is incredibly helpful and incredibly on point with what I feel like we do in veterinary medicine, or we aim to do in veterinary medicine, in terms of supporting both the patient or the pet and their family when we're deciding what can we do for this patient from here. I also think this is really also in keeping with traditional Chinese veterinary medical principles, where we see that we are trying to balance the body, balance the spirit as much as we can in order to further its ability to withstand or live with the disharmony that's going on in the patient. One of the reasons why I love traditional Chinese medicine is the fact that it is all about balance and flow. And so, if we have a disharmony or something that could be terminal for a patient, it doesn't mean that we can't work on the other parts of the body to help to have some more harmony or to balance things out. Um, I also love the concept of not necessarily harping on um, curing the disease or curing the problem. There's a lot of medicine that we use at Sleepy Dog that is not about cure. So it may be a chronic condition like inflammatory bowel disease or horrible skin allergies. It may be a condition like lifelong anxiety. It may be a condition like cancer or metastatic cancer. It may be a problem of failure of kidneys or liver, but I like that we can treat all of these patients with that in mind, knowing that there is a disharmony, but there is also a lot of hope associated with how we can make them feel better. When I was studying animal hospice and over the years, it has definitely been pointed out that our society, our Western society in particular, which is what I know, is very, in our culture, we're very removed from death as a concept. It is not necessarily the case that most people see someone die in their home. And so it is really something that we have both physically and emotionally distance ourselves from. And so now I see it with my patients and my people in that we have to become more comfortable with the concept of dying and the concept of chronically ill patients in our midst. And that takes a lot of work on our part. Another thing that comes up a lot when it comes to um, animal hospice is there are some different perceptions and different focuses with different animal groups on does hospice and palliative care relate specifically to humane euthanasia, or is the goal for that animal to have a natural death? I, in particular, am not wed to either thing, but I do feel very strongly that when we do intervene with humane euthanasia, at the very end, when we cannot control that animal's pain and suffering, that at least we have less of a chance of having something traumatic happen, we can kind of preclude that. But there, just so I attend to that in this talk, there are definitely strong feelings either way on which is better. And for me, it is more about talking to the families I work with and putting that animal's best wishes from what we can tell in mind. So if we're talking about pain and suffering, so when I was first in practice, my main focus on pain was musculoskeletal pain. So things like arthritis, back pain, um, certainly skin issues can be involved in this, bed sores for those that are chronically ill, all sorts of different things, weakness that can lead to scuffing of feet or lead to further troubles. And that is absolutely still true. We really have to pay attention to that as veterinarians. There's also, though, visceral pain. And so things like intestinal pain, bloating, diarrhea, vomiting, any kind of internal organ pain, just as important and sometimes overlooked because we have patients that cannot speak to us. So we have to look for evidence of that. The other thing that I have been made aware of more and more over the years is emotional and mental pain. So if an animal is confused because of an organic condition like a senility or kind of a dementia, or if they're confused because of medicines that we have them on that's causing that as a side effect, anxiety with as animals are older and sometimes lose their sense of sight and sense of hearing, that can lead to some increased anxiety, not being able to get up and down in the ways that they usually can. That can lead to anxiety, sometimes incontinence issues as well, and depression. So animals in the later parts of their lives, if their routines have changed dramatically and their lives are limited or related to pain, they can show signs of depression. So those are all different things that we look at, and things that I look at in particular. I call them my pain triad. And so I usually go down the list and make sure that I'm attending to each of those things and making sure that I'm watching out for those for my patients. Um, so in animal hospice, another thing that we are very concerned about is the pet's individual preferences. And the first question you might think is, well, how do we know? If you think of your own pets, we do know. We could have a very scared, cold, older cat. And on the one side of the spectrum, and we could have a very social, big, boisterous dog. And those patients are going to need radically different things for them to get what they need from this lifetime. So, for our scared older cat, we might decide that the most important thing for their quality of life is to stay at home, not have any car rides, be nice and warm and cozy. Maybe they would have a house call vet come to do their monitoring and do a lot less hands-on, more telemedicine, phone calls, video chats, that type of thing. Whereas our very social, boisterous dog, we might have in our hospice treatment plan, we might have more visitors come, more car rides, more outings, maybe more physical treatments like massage, physical therapy, acupuncture, chiropractics. But that type of thing that could really, really feed the souls of both of those patients. In terms of quality of life, there's many different scales, many different assessments. Some of my favorites are found. The Lap of Love website has great quality of life assessments and scales. There's a Gray Muzzle project, which is an app that you can download. Some traditional pain scales that we've used in veterinary medicine include the Glasgow Pain Scale and the pain scale, which actually looks at different discrete measurable things that we can put all together to see if it's something that we feel like that patient or that pet's quality of life is starting to dwindle. When that seems too overwhelming to people, sometimes what I'll have people do is write a list of what they see as what their pet enjoys the most in this life. And I have them make that list, and then I have them store it away. And we schedule times for them to go back and reevaluate. And if there is something that over the course of months or weeks or days, we're crossing more things off the list, then we know we need to reassess and reexamine what's happening. That being said, all of these different parameters can be very helpful. Levels of pain, checking breathing rates, interacting with the family, levels of exercise, heart rate, all these things. But we do have to bring into it the balance of flexibility as things change. And also keep in mind what was our vision for when we started this hospice care, if that makes sense. I think one of the biggest things that we can do to help with hospice care is communication. I often have my clients make a daily log, and this functions for several reasons. So, one, it tracks symptoms. Usually, what we do is we come up with some parameters that we're going to have that client, that person track. So, what was their appetite like? What was their activity like? I often ask them to track what the weather's like because that can often impact different kinds of musculoskeletal and visceral pain. So we come up with some parameters, we write them down every day. This can also help not just tracking symptoms for if things are getting better, worse, changing, but it also gives us a sense of time. We as humans, we remember the bad things as bigger often and the good things as smaller. And so if we see that there are 3 days and they're really, really bad, then we have a stretch of 20 days that are really, really good. It's going to give us a better sense of how to what the balance is really like, not just what it feels like in our bodies. That being said, I believe that if you have really, really bad days, that and you have like one really, really bad day to 3 really, really good days, it doesn't negate the bad day. So we still have to look at it in balance. There's also a function of the daily log that I like and I think that is helpful to a lot of people, which is there's a power to writing something down, writing our measurable parameters down, taking the time to do that, but then also putting it away and letting it go. Because sometimes we are so worried about our pets that when they're in this stage of life, that we kind of go back and keep reassessing, and it is hard on our hearts and it's hard on our relationship. So if we can take, of course, if something big changes, we will address that. But if we can take that time, measure what our parameters are, and put that away and know that we're going to do that tomorrow again, sometimes there's a freeing power to that. I think it's also really important to have scheduled check-ins with your veterinarian, and or your veterinary nurse. This can be done even in these times of COVID with telemedicine. We can use the cameras on our video chats. We can use the phone. We can use email, all these things to see what's going on. We can catch things earlier. And also, it can give us all a real sense of relief if things are going well. The other thing is the power of the physical exam. So a lot of times we want to balance how often we're asking the pet to be seen by a veterinarian. But there are times when that information that we get from our hands with our physical exam can be really priceless. There are sometimes comments that hospice care means no more tests, and that is something that I've thought a lot about over the years, and I don't think that that is necessarily the case. I think um, there are some pets that the idea of doing some lab work or taking an x-ray or doing an ultrasound is just off the table. The animal is too stressed and we're just going to work with what we have. But there are many animals that is not necessarily the case. And we just want to choose which tests we are going to use wisely and make sure that the tests that we are using are going to change the way we treat our patient, not just for information purposes. So there's many times when we would want to do blood work, checking for liver and kidney values to see where we are in terms of the body function, but also what flexibility we have with different medications and different treatments. Urine testing, very common. It is very common for animals who are in hospice care to develop things like urinary tract infections. That is a huge quality of life that we can impact with some simple medicines. So it's absolutely something that is worth doing. There's also times when imaging is helpful. If we're worried about the function of the belly, the function of the chest, taking an x-ray in a calm way without having to use any sedation or maybe using very mild sedation can make a huge impact in how we treat the patient, how we assess where they are in their particular process. So just a note on that. When it comes to hospice care, as a veterinarian who uses both conventional and alternative treatments, I am a huge advocate for using all that we have. So when it comes to pain control, I'm going to use acupuncture if possible, if that's something that the animal is cool with. I'm also going to use Western medicines if that's something that is going to help that patient as well. I'm going to use antibiotics if there's an infection, but I might use some herbal supports if I am trying to reduce inflammation. So all different things so that we can help to use the minimum amount of medicine that would cause side effects and impact their quality of life, but achieve the maximum amount of comfort for the animal. Nutrition, same thing. I'm going to use fresh, beautiful foods when I can, but there are certainly times when I'm going to reach for a prescription diet if that's needed. Same with mental health. So sometimes, no matter the herbal medications or the lifestyle changes that I make, the animal might be anxious. And it could be that their brain chemistry is a little off. It could be a myriad of different things, but I'm going to reach for something that's more conventional at times. There's other times that I can manage things with more alternative treatments. Exercise and lifestyle is going to be a combination of all these things. We might use some physical therapy principles to help to keep the animal strong and enrich them. We might, we're going to go around their house and make sure that we have good traction in the house, make sure that we have good padding for where they lay, that they have a good sight line of their family members if they're in a more limited space. But it is definitely something that I believe strongly in, that we have to use both um, to reduce the overall medicine that can cause side effects, but also address all of the quality of life and pain and suffering um, concerns that we have. So, also, the thing that I have definitely noticed over the years is that we as veterinarians and veterinary teams support our clients and the people that come with the pets just as much as we are supporting their pets. And so it's really, really important for everyone to be communicating. So, communication within the family. Often pets have more than one caregiver, and it can be helpful to have someone there to listen to all of the people that are caring for them. It is very common for animals to have one kind of presentation for a mom and a different one for the other mom or dad. I know that in my life, I have seen that my older dogs will sometimes bring forth this great energy if my husband is going to take them for a walk. Whereas with me, the mom, one who does the medicine, that type of stuff, they'll show a little bit more vulnerability. So all those things are true, and it's important to hear what everybody has to say. There's also the communication within and with the veterinary team. So making sure that you are communicating any changes that have happened between check-ins with your veterinarian or your veterinary nurse. I always say that we can always say that we're not worried about something, but we can't say that if we don't know what's happening. So if there's something that you think, oh, maybe it's just in my mind, first of all, it's usually not. Usually you're picking up on something that has changed. And second of all, we are always happy to say, nope, let's just continue to monitor. We're not worried about it, but it gives us the opportunity to weigh in. And if it is something we're worried about, or we do want to check something, then we get a little bit of a head start. There are also grief and caregiver support options that are available. For us at Sleepy Dog, we have Lori Levine, who's a wonderful support. During times of non-COVID, she has a support group, and and also individual counseling. This is really important because depending on where you are in the world, what your family life is like and what your work life is like, you may or may not have as much support as you need. I learned certainly when I lost my first dog that the amount of anticipatory grief that a person can experience when they have an animal who has a known chronic illness or a known terminal illness is pretty intense. I do believe that this helps us as humans kind of practice and get used to the idea of what it's going to be like when we lose that family member. Um, but I do think that it's really hard, and it's not something that everybody understands. So it's really helpful to get in touch with or grab the support of either people in your life who know what you're going through, have been there themselves, or love your pet in a way that they can really understand. And if you don't have that, then to reach out for some help that will understand and help you through it. So it's not just when a pet dies that these emotions come up. It's also amazing how many different things our pets have been with us through, and how those things come up as we're going through hospice care with our pets, or we're anticipating the loss of our pets. If you are not in the Sleepy Dog area, certainly reach out to us and we can help find someone through our networks too that may be able to help. I also thought that I would mention that the veterinary team, we as veterinary team members need to make sure that we have the proper support too. Our field is actually full of mental health challenges, and it's sometimes not always the things that people expect. So, veterinary medicine has attracted a type of person that is very compassionate, very often perfectionist. Getting into vet school, getting into veterinary technical school is no joke. And so, to get there, you have to do a lot of hard work to stay there and finish that, to do a lot of hard work. Um, our field has not been incredibly aware until recently about kind of promoting work life harmony. It's also a field that has a lot of student debt and much lower wages compared to our human medicine counterparts. There's also something in veterinary care that can be really hard, which is that money comes into play all the time. So, where human healthcare, our insurance system, while it has lots of room for improvement, when you go and you get a blood test, your insurance is kind of on the hook for that. And you think about all that stuff later in terms of cost for us. And for most of our patients who don't have insurance, we have to think about that the whole time. So money can sometimes guide what we're able to do as pet owners and also as providers. And the costs are more like visible, and so that can be a very hard thing to manage as a veterinary team member. So it's important for us to take care of ourselves. One way that we do this at Sleepy Dog is we are big walkers. So we often take walks during our breaks to kind of burn off steam and make a healthy transition. We also try to do check-ins during the day. We also have Jenna, who's our veterinary social worker, who is incredibly helpful in helping us understand where our clients are coming from, understand how to resolve conflict in the workplace, how to take care of ourselves better, and when something is something that we can handle or something that we need to refer a client out for. I think the other thing that I think about when I think about veterinary team support during hospice care of our patients is that we have our pets, our own pets. And so not only do we lean on them incredibly as support for ourselves, but when it's our turn to grieve, we forget all of these things. And I know that for myself and for many of my colleagues and team workers, even if we know all the ins and outs of all of this and we've done everything we can, we still go through all the same processes of, did I do this too long? Did I do this not long enough? Should I have made a different decision? And so it's important for us to be gentle with ourselves. I'm speaking to myself. And everybody grieves in different ways, and that's okay. And to give ourselves and our patients, well, not our patients, but give our clients permission to grieve in whatever way makes them the most comfortable. I think, let's see. So I'm going to take this moment to kind of introduce this concept that I am envisioning for kind of the next phase of Sleepy Dog Veterinary, which is my third baby, two human babies, many fur babies. But Sleepy Dog is, I consider her my third. So the next phase of my vision is something that I'm going to title Individualized Integrative Care. And I think that it's something that we do well, but I would like to do even more completely and with even more intention. And so that's to treat each patient for their individual needs with the best treatments for their body and their spirit. And typically, we have seen animals who are often in hospice care, often in palliative care situations, and often have lifelong chronic conditions. But I would like to see us grow a little bit and perform this from everything that we do for our current patients, but also a little bit more to include this individualized integrative care from adoption to when we usher them out of this world. And so what this to me involves is a lot of communication, using our newfound telemedicine to help use it for like really true preventative care, and using all of the things that we have learned as Sleepy Dog that on the alternative medicine side of things to truly integrate them in with all of the Western medicine that we have available. And with that, that is all I have to say today during this FaceTime Live. If you have any questions, you can certainly feel free to write them under this on Facebook. You can also give us a call. Our phone number is 781-643-2162. And our email address is dreamteam@sleepydog.vet. And if you have any topics that you would like to me or Nurse Sam or any of our other pals at Sleepy Dog to address, feel free to let us know that too. We're trying to span these topics during this time where everyone is a little bit more likely to be home. Our next topic, our next FaceTime Live will likely be with one of our patients. So we're probably going to talk about moxibustion in particular, but I thought it might also be helpful to have everyone see what it's like to have their patient or their pet treated in our facility. So anyways, I am sending love and hope to everyone during these times. Stay safe, and I will see you soon. Okay, thanks. Take care.